As a new nurse, I was concerned with the clinical aspects of nursing. I received this new patient, the doctor. He came in and we began to converse. He told me that he was born in Africa and had studied in Germany. And that being my native heritage, we were able to converse back and forth in German and develop a bond. Then I asked him about his illness. He became very emotional and told me about an idiopathic lung disease that he had developed. And then with tears in his eyes, he told me how he had collapsed and coded during a physical therapy session. He said that he was intubated, and at that point he had reconciled with himself and with God that he was going to die. But that didn't happen. The next day, the doctor was being discharged. I stopped by to wish him well and say goodbye, and he thanked me for the care that I had given him, and especially thanked me for listening to him. He said it had been important to him to be able to tell his story. He said that he'd been a doctor for many years, but it took this illness for him to realize the importance of good dynamics between the caregiver and the patient. During my stay in the hospital, I had several nurses, but there were two in particular that stood out in my mind. They were patient, they answered my questions, and really calmed my fears. It was at that time that I learned that it's not just the clinical skills that are important in nursing, but the caring words, the listening ears, and patience that are so important in the nursing process.